How are we supposed to treat hepatic encephalopathy? Number one is to decrease this ammonia production and flumazenil, mannitol, and for seizures. Okay, so to decrease the ammonia production, the agents used are lactulose, antibiotics, and sodium benzoate. Lactulose acts by causing osmotic diarrhea. Metabolism of lactulose by colonic bacteria result in acid pH that favor the conversion of ammonia to poorly absorbed ammonium ions. Direct effect on the bacterial metabolism causing decrease in the ammonia production. Antibiotics by causing gut bacteria suppression, because like when the bacteria is continuously acting, what happens is it is going to produce ammonia and all, which is bad, right? So like antibiotics like neomycin and ampicillin are going to be very helpful. Biochemical neutralization of the ammonia, sodium benzoate, especially in lactulose resistant cases. And then, so that was about it, lactulose and antibiotics and sodium benzoate. Flumazenil antagonizes the endogenous benzodiazepines. Mannitol to reduce cerebral edema. For seizures, short-acting benzodiazepines are used, or oxazepam, midazolam, paraldehyde. Oxazepam, midazolam, and paraldehyde. That's right. So for seizures, short-acting benzodiazepines are used. For example, paraldehyde, it's a weird name, midazolam and oxazepam. Okay, so the new drug which is being used in hepatic encephalopathy is rifaximin. It's not rifa, it's not the rifampicin of the anti-TB drug. It's rifaximin. Okay. And then there's this classification, it's called the Child-Pugh classification of cirrhosis. To assess the severity of cirrhosis, it is based on certain factors, five stuff. Okay. So the first one is serum bilirubin, mg percentage, serum albumin gram percentage, ascites, PT or INR, neurological disorder. Serum bilirubin, serum albumin, ascites, neurological disorder, PT-INR. So serum bilirubin is going to be in the form of milligram percentage, albumin is gram percentage. Recently, the Child-Pugh classification system has been replaced by the model of end-stage liver disease, MELD. MELD score for assessing the need for liver transplantation. The MELD score is a prospectively derived scoring system designed to predict prognosis of patients with liver disease and portal hypertension. So MELD score on the prognosis of patients with liver disease and also portal hypertension. Prospectively means like today we are going to assess the prognosis for the person in the upcoming future. The MEL score is calculated using three non-invasive variables such as PT-INR, creatinine, and bilirubin. So recent advances are there. Recently, the Child-Pugh system has been replaced by the MELD. MELD is model for end-stage liver disease score. Okay, so like prospective prognosis for patients with liver disease and portal hypertension, PT-INR, serum bilirubin, serum creatinine. These are all the non-invasive variables. Okay. Mm. A summary of the clinical features of hepatic failure, regardless of the cause, the clinical signs of hepatic failure are much the same. So, like the person can have jaundice. Jaundice is almost an invariable finding. The person has a liver failure, there is jaundice. Fetor hepatic, fetor hepaticus, characteristic musty or sweet and sour body odor caused due to production of mercaptins. Remember this name, mercaptan, okay? Mercaptins by the action of GI bacteria on the sulfur-containing amino acid methionine. Palmar erythema, spider angiomas, is caused due to impaired estrogen metabolism. Palmar erythema and spider angiomas. Hypogonadism, gynecomastia, caused due to hyperestrogenemia, more estrogen. And then hypoalbuminemia predisposes to peripheral edema. Hyperammonemia plays a role in cerebral dysfunction. Hepatic encephalopathy, regarded as a disorder of neurotransmission in the CNS and the neuromuscular system, and it appears to be elevated with blood ammonia level, which impair the neuronal function and promote generalized edema. It is associated with only minor morphological changes in the brain, and encephalopathy is reversible if underlying hepatic condition can be corrected. Hepatorenal syndrome, appearance of renal failure in patients with severe chronic liver disease in whom there are no intrinsic morphological or functional causes of renal failure. So that is about hepatorenal syndrome. The kidney is completely fine, but then the liver is not fine. Treat the liver. Thanks.